Phil Farr has been investigating crime for more than 20 years. As a detective, collecting and analyzing evidence is his job. But back in 2003, he ran into a mystery he couldn't solve. After a round of high-speed driver training, Phil was left with nausea and a headache that wouldn't quit. He thought a sick day and an aspirin would cure him. He didn't have a clue how serious things were until he tried to talk to his wife.
I went home and wasn't really feeling hungry, and so I tried to ask my wife, Wiley, just put a bag of popcorn in there for me, I'll eat some popcorn and then go to bed. And that's what I planned on saying to her. But when I tried to say that to her, it was like, blah, 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 blah.
He can kind of joke around sometimes. So when he came in and was trying to tell me, put some popcorn in, and he was all kind of garbly, whatever, I just kind of looked at him and I said, if you can't ask right, you will get nothing. And then I saw the look in his eye and went, ooh, he's not joking here.
She was coming down the stairs at the time, and she stopped and she looked at me, and I looked at her and I tried to say it again. It was
Phil had suffered an ischemic stroke, a potentially deadly event that occurs when blood supply to part of the brain is interrupted or cut off. About 80% of strokes are caused by blocked blood vessels. Like many other patients, Phil had no warning that it might happen to him.
I'm a little hard-headed guy, I guess, and I was thinking, something's going on that'll, they can give me a pill or something and tell me to get some rest and I'll be okay, But when they first mentioned stroke, I was 47 years old at the time, and I'm thinking, stroke? You'd be kidding me.
The cause of Phil's stroke was a dissection of his left carotid artery. The carotid artery supplies the brain with oxygenated blood. During speed driving, Phil's carotid tore slightly, which allowed blood to enter the wall of the artery. The pressure split the wall layers, causing the dissection. Clots formed and blocked the artery, severely limiting blood flow to Phil's brain. It was a very serious situation.
Clearly every minute counts. Every minute that passes by, there's less brain that can be salvaged when someone's having a stroke, and so expediency is key.
Phil was treated initially at a hospital in Mount Vernon near his home, then referred to the UW Medicine Stroke Center at Harborview Medical Center for more specialized care.
Phil is from a small town, and the expertise for treating these complicated neurological issues just doesn't exist at smaller hospitals. Good to see you.
Good to see you.
Dr. Kyra Becker, a vascular neurologist and co-director at the UW Medicine Stroke Center, oversees Phil's care.
I want you to just take a look at my finger and follow it with only your eyes. Phil's case is really unique because here he is, a young, healthy guy in his 40s who had a stroke without any of the classic stroke risk factors. And so why did that happen?
That's the kind of question Dr. Becker's team answers.
We were able to determine that Phil had a carotid dissection that led to a blood clot that went to his brain to cause the stroke.
Rehabilitation went well, and Phil was able to go back to police work. But 5 years later, something happened again.
I could hear this whooshing sound. In fact, I went to bed that night, and I was thinking, what in the world? Did I leave my pager on the dresser, Is it vibrating? I got up to look, and I laid back down, and whoosh, 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 this really loud. And then I figured out, it dawned on me, hey, that's my heart. I'm hearing this thing, and it's just not right.
It was another carotid artery dissection, this time on Phil's right side. He returned to the UW Medicine Stroke Center and Dr. Becker.
Philip's case is really unusual. Most people who have a carotid dissection will never have recurrence. And when people do have recurrent dissections, it raises the possibility that there's an underlying connective tissue disorder. And in Phil's case, he was evaluated by a medical geneticist who's a world expert on connective tissue disorders. So it's really quite amazing to have the level of expertise not only in stroke care, but in medical genetics and medicine. Can you do this?
With his left carotid artery already damaged, Phil's situation was very serious. The potential for a second stroke was high.
They showed me the picture of the thing, and the carotid artery here looked like a rubber band that had broken and was laying in a jumble on the table. I mean, it was just amazing, and the blood flow was like 5% on the right side. Well, I already have minimal almost 0% on the left side. And Dr. Becker said, after she talked to me for a few minutes, she says, well, it's not good.
I mean, I feel like I almost lost him twice.
In the 5 years following Phil's first dissection, there were some dramatic advances in technology that allowed specialists in interventional neuroradiology to open his carotid artery with a stent, protecting him from having a second stroke. Stents are effective when the stroke has been caused by injuries to an artery, which was the case for Phil. Dr. Raj Godke and Dr. Danial Hallam performed this procedure using a specially designed stent to open the delicate vessels in the brain. They start by inserting a very small catheter in an artery in the leg.
Through that small catheter, we thread a much longer catheter all the way up through the aorta into the arteries in the neck. At that point, we inject X-ray dye and take pictures to allow us to see what we're going to treat and to develop a map by which we can treat it. We even call it a roadmap. Using that map, we thread fairly delicate catheters and wires into the brain and to near the area of narrowing in the artery that we plan to treat. And we leave a wire behind, and over the wire we thread a very specifically designed catheter that has a stent mounted on it, and we gently uncover the stent, allowing it to expand into the artery.
This is the kind of specialized care that makes the UW Medicine Stroke Center at Harborview a vital resource for other hospitals in the region.
We're willing to do whatever it takes to make sure that patients get the right kind of care.
It's a middle-aged man who presented yesterday afternoon with the acute onset of left-sided weakness and paresthesias, but he was alert and oriented ×4, knew where he was, knew what was going on, was able to communicate, but could not feel anything on the left side.
Phil's local hospital and the UW Medicine Stroke Center are participants in a partnership called TeleStroke. Harborview is the core, with satellites reaching out to many other medical facilities in the Puget Sound region. Specialists at Harborview are available 24 hours a day for consultation and assistance. Immediate treatment is essential in treating patients who have had a stroke.
When the physician or referring hospital calls, we certainly are able to offer them expertise in reviewing films and advice about what the next steps would be. We're also willing to go out to the hospitals, do education for the staff there so they know how to better recognize neurological problems.
When TeleStroke partners transfer patients to Harborview, they can stay connected to those patients through electronic medical records. It's a partnership that has paid off in successful treatment for stroke patients.
Without the relationship between the smaller hospitals and Harborview, Phil probably wouldn't have gotten the care he needed.
I mean, I knew that's where he needed to be, and it was a big relief. And he was in the hospital 10 days, and I spent a lot of time down there at the hospital, but I mean, I could come home and not worry about anything, you know. And so, no, I knew that's where he had to be, and with Dr. Becker overseeing his care, I felt pretty good about it.
Best of all, Phil has been able to continue doing the work he loves.
My big thing was they were going to tell me I could no longer practice my profession, so to speak. And what else can I do? I'm a cop, I've been a cop, and probably would be hard-pressed to do anything different. I pretty much take care of my house and my yard and pretty much do everything I did before.
In addition to the expertise of its medical team, the UW Medicine Stroke Center often has access to technology before it's commercially available to other institutions.
We participate in the development of new devices through our feedback with the manufacturers. As a result, we get the latest and greatest updates as soon as they happen. The research we're involved in is applied directly to patients as soon as we feel it's appropriate. So I'm holding a clot aspiration system. It consists of a specifically designed catheter for use in the brain.
A recent addition to the technology available to treat ischemic strokes is a clot retrieval system. It's a mechanical device created to remove clots directly from a patient's brain. A key advantage of this system is that it extends the window of time during which a patient can be treated following a stroke. While drug therapy needs to be administered within a very few hours of a stroke, for example, clot retrieval may double the time frame for effective treatment.
Mechanical devices can be used in the front of the brain up to 8 hours, and the back of the brain much longer, depending on the patient's specific circumstances. Since many people don't make it to the hospital in the first 3 to 4 hours, but quite a few more make it in the first 6 to 8 hours, we're able to treat a lot more people.
The procedure involves inserting a cone-shaped wire through a tiny catheter into the delicate arteries in the brain, which breaks up and vacuums out the clot.
It's essentially a highfalutin vacuum that creates some suction on the catheter and pulls the clot out. So here's the starting run.
Clot retrieval depends on very detailed imaging during the procedure.
We put a catheter into the arteries in the neck, we inject X-ray dye, we create a map so we know where we're going, we know where the road is and where the road is not, and we advance the system very carefully into the arteries where we want it to go. And then as we're aspirating or pulling out the clot, we can watch under X-ray fluoro. We don't see the clot itself because the clot doesn't show up on X-rays, but we can take pictures from time to time injecting X-ray dye to see if we've improved the flow.
The UW Medicine Stroke Center was the first in the region to offer the clot retrieval system to patients.
It's not a new concept, but it's a new application. In the past, we didn't have catheters that we could advance into the brain that were the right size that would allow us to aspirate or pull out clot, but now we do, and it's a matter of people knowing that the need was there and carefully developing the right technology. It's not rocket science, but it is brain surgery.
This particular type of brain surgery, using a minimally invasive endovascular approach, isn't available to many of the stroke patients who could benefit from it. It's the kind of treatment found at a Joint Commission certified stroke center, like the one at Harborview.
Because so many of the people here in the stroke center are on the cutting edge of research, we really are using the latest and greatest techniques to improve outcome and to ensure that their patients really are receiving the best possible care.
The UW Medicine Stroke Center's multidisciplinary team of physicians includes vascular neurologists, vascular neurological surgeons, physiatrists, interventional neuroradiologists, and diagnostic neuroradiologists. Nurses in the neurological ICU have specialized stroke training.
In addition to that, we have a pharmacist who rounds with the neurology team every day, who helps guide therapy, which is a very unusual thing. In most hospitals, most programs aren't afforded that luxury of having a dedicated neurological pharmacist.
He then received TPA.
The pharmacist is essential to providing TPA, or tissue plasminogen activator, a life-saving drug therapy for patients who have had an ischemic stroke. It has to be administered within a very few hours after the stroke.
It is what we call a fibrinolytic, or a drug that dissolves blood clots. The goal is that if you give TPA soon enough after stroke onset, it will actually open up a blocked blood vessel and restore blood flow to the brain. When you look at the things that have been proven to improve outcome in stroke, there are very few. Receiving TPA and that 3 or maybe 4.5 hour time window is one. And being cared for in a stroke unit by people who know what they're doing is one of the other ones.
While teamwork and technology are vital to treatment outcomes, nothing is more important than recognizing a possible stroke and calling for help immediately.
If you think you're having a stroke, you should call 911. That's really the only advice I can give you. Never drive by personal car to the ER if you think you're having a stroke or your loved one's having a stroke. Always call 911.
The time element's critical. We have found in the last 10 to 15 years that we're able to treat a number of strokes effectively once they get to the hospital, but we only have a few hours in general to do it, somewhere between 3 and 8 hours generally in the front of the brain, a little more time in the back of the brain.
Signs of stroke include the sudden onset of these symptoms: numbness or weakness on one side of the body, confusion, difficulty speaking or understanding language, dizziness, loss of balance or coordination, loss of vision in one eye or on one side of space, or double vision, and sometimes severe headache, although often there is no pain at all with a stroke.
Stroke is a sudden change in the way your brain's working, so a loss of function. Say you can't suddenly use part of your body, your arm or your leg on one side, or you might have difficulty understanding someone speaking to you or speaking yourself. It might also have to do with a more general loss of your level of consciousness. You might go from your usual alert self to being very drowsy, very dizzy.
Risk factors for stroke include high blood pressure. About half of all strokes may be caused by uncontrolled hypertension. Smoking, diabetes, high cholesterol, family history of strokes, age. Risk increases with age, but younger people are not immune.
Hold on, Blackie. Come on.
Anyone can suffer a stroke. 3 years ago, Cecilia Fomai found that out. She was only 23 and had no idea she was at risk.
I don't remember anything from that night. I don't know. I don't remember anything from that night. When my husband told me that I woke up crying that I had a bad headache, so he went and got me some Tylenol, and then by the time he got back in the room, he saw I was like stiffening up, and I was like going into a seizure or something like that, and that's all I remember.
Her husband called 911. Cecilia was unconscious when she arrived at Harborview.
After she came here, we did a CAT scan, which showed that she had a pretty big hemorrhage in the ventricles of the brain. So it was in the brain, but it was in the fluid-containing space inside the brain, pretty severe. Do you remember being in the hospital after the initial bleeding?
No.
Yeah.
A hemorrhagic stroke happens when a blood vessel ruptures and causes bleeding in or around the brain. About 20% of strokes are hemorrhagic. Dr. Lalagam Shekhar, a neurological surgeon at the UW Medicine Stroke Center, acted immediately to relieve pressure on Cecilia's brain.
We inserted a tube called a ventriculostomy to drain some of the blood and relieve some of the pressure. You could see the blood clot, quite a big blood clot here. And this white is the tube that was put into the brain to drain the blood clot. See that?
Wow.
She was in a very bad condition at that time. She actually was in a coma when she came here initially. And she improved a little bit with the drainage the next day.
Say, I love you. I love you. Say, we miss you.
The consequences of Cecilia's stroke were severe. Looking at home video taken early in her recovery, Cecilia and her sister-in-law Anna find the memory of that time very painful.
So do you remember when you were like that?
No, I actually don't remember that day. I feel like crying when I see that picture of me. Look at the lost look in my eye.
Well, you can barely hold your head up.
I couldn't walk. I couldn't talk. I couldn't even eat myself. Somebody had to feed me. I was basically laying in the bed.
Here we're looking at the carotid artery in the brain.
In order to treat Cecilia, Dr. Shekhar had to find out what caused her stroke. A brain scan using contrast dye, called a CT angiogram, showed an arterial malformation caused by moyamoya disease. Originally described by a Japanese neurosurgeon, the name means puff of smoke. It affects the carotid arteries, the main source of blood to the brain.
The carotid arteries, as they go into the head, they develop a progressive narrowing of the artery, and they get slowly smaller and smaller, and they become completely occluded. And the exact reason for this is not known, but pathologically what happens is the inner lining of the artery, which is also called the intima, becomes more and more hyperplastic, and then it just shuts off the vessel completely. Now, the body, however, has a reaction to this because this happens slowly, of course, in most patients. So what they develop is there are very tiny vessels which are branches of the carotid artery. These are called lenticulostriate vessels. These are very tiny vessels. They become gradually dilated, and they start to pull in the blood flow from other vessels in the area. And that's what gives the appearance on angiography of like a puff of smoke, because they are very tiny dilated vessels.
Moyamoya is a relatively rare disease, although people of Asian descent are at higher risk. Dr. Shekhar performed a microsurgical procedure called a cerebral artery bypass to repair Cecilia's vessels. He operated twice, first on the right side of her brain and then on the left.
We took a vessel on the scalp called the superficial temporal artery, and we connected it to a vessel on the surface of the brain. It's an operation which is performed at a very high magnification with a very high level of skill and dexterity, because these vessels are very tiny. And what happens is over time these vessels dilate, and then they take over the blood supply. Instead of the carotid artery, we are sort of building new vessels.
Harborview is one of only a few places to offer this treatment for moya moya.
Very few neurosurgeons would have the expertise of treating such a patient, performing the bypass procedures, which are sometimes very complex. And then the further follow-up care is also very important.
So there you are.
As Cecilia began her recovery, support from staff and family was vital. Her sister Rosalyn was her biggest cheerleader.
If I didn't want to do something that she said that I had to do that was going to make me better, that she pushed it. And I'm glad she was like that with me, because if she wasn't like that with me, I wouldn't have done it.
Throughout her hospital stay, specially trained nurses monitored Cecilia's condition.
The nurses that work in the stroke unit and the neurological ICU undergo special training to become expert in doing the neurological examination, as well as in all aspects of stroke management. So they're able to tell when something's changing. So if a patient who's been treated for a stroke or comes in with a stroke starts to evidence new symptoms or signs, they know right away. They alert the docs, and we know that there's something that needs to be done.
I can't tell you how many of the nurses over there, I love them. That's how much they helped me in the hospital with my sister and my husband and my sister-in-law and my whole family.
They put up with all of us, which was a very, very large Samoan family, and they just let us know hour by hour what's happening with her.
Recovery has taken time, but Cecilia is nearly independent again. She can no longer drive a car, but she goes to the gym with her husband and continues to regain her strength.
She came from in a bed, not talking, not being able to go to the bathroom, in a diaper. They got her walking. You have to learn how to walk and talk and they did this.
I am grateful. That's one thing I am grateful to everybody that helped me and has been there for me.
She's doing very well. Of course, she's a young lady. She has a lot of years ahead of her. We have to continue to follow her by performing angiograms and other tests, throughout her life.
Her family has a simple goal for Cecilia.
As long as she's healthy and she's happy, that's all we need.
Cecilia herself has another goal in mind, and she's determined to reach it. She loves being an aunt, and she wants a child of her own. Once her doctors approve, she plans to become pregnant.
Have a baby. That's one thing that I want with my husband, is to have a baby.